for the NITAC. The NITAC, or the South Sudan Immunization Working Group, they've reviewed mainly epidemiological data such as disease burden, vaccine efficacy studies, and then it considers global regional guidelines that also aligns with WHO position papers. The NITAC also consider, or the CITAC, let me say, they considered recommendation that support South Sudan health system realities, such as immunization coverage, cold chain capacity, surveillance report. They also look into, most importantly, those recommendations. Those recommendations should align with the national immunization strategy. Yes, very unfortunate. The CITAC did not look into the private sector involvement and to vaccine delivery. And this is based on that the private facility has to abide with some regulations regarding vaccine deliveries, such as, for instance, out of pocket, because those private sectors, they are mainly income generating bodies. So they mainly focus on, for instance, income generating activities. So there is a fear that immunization delivery should be channeled into money generating activity. Then there is also a challenge that is there is limited regulatory oversight and monitoring tools which are not involved in such activity. And then there is also a problem with the cold chain. However, in the national immunization strategy, it is stated clearly that it prioritizes access to immunization for undercovered population and zero doses children. And this one highlights an area of collaboration and partnership with the private sectors. So the strategy talk of private-public partnership strengthening, whereby the Ministry of Health will collaborate closely with the private health facilities to strengthen the immunization network in areas like cold chain equipment. They also support training and ensure availability of vaccine and access. As George mentioned, or as your question, I think the minister has to work on a framework whereby the private sector should follow to implement those activities. Over to you, Anne.
Thank you so much, Dr. Rose. I think I've picked a few points from you that there has been an issue involving the private sector because there's concerns about the possibility of immunization or vaccination being turned into an income-generating activity. And there is limited regulatory oversight over these facilities, and they don't have access to the monitoring tools and might have issues with cold chain. However, what you have indicated is that the Ministry of Health and multiple partners have been able to actually see that there is a gap and that there is need for public and private sector collaboration. And some of the things that have been implemented are looking at cold chain and looking at training. So this is a gap that's quite huge. Given the fact that most of our population is served by either non-governmental organizations or faith-based organizations. And it seems like there's a lot of work to be done when it comes to creating trust between the private and the public sector, and also ensuring that there is oversight and regulation and monitoring if we decide